So we're back. Hi, Dong. Ate, salat din na ba? Yapunin mo tong... Okay, so we stopped at the hand rubbing. Okay, so we're back and we are discussing about hand sanitizing. So how to use the hand sanitizer. So in hand sanitizer, it is with the alcohol-based hand rub, which is between to 60 to 90% of isopropyl alcohol. So how to use our hand sanitizer? So apply a gel product to the palm of one hand, read the label to learn the correct amount. So rub your hands together and rub the gel over all surfaces of your hands and fingers until your hands are dry. This should take around another 20 seconds. So in hand hygiene, it is 20 seconds. And so the same thing with our hand rubbing, it goes with the 20 seconds also. So nowadays, there is a updated or a simplified, okay, hand rubbing technique that has been issued by the CDC, the Communicable Disease Council. So this is how to hand rub. It is the same with the hand washing. But to the new 2020, based on the CDC, they have a simplified three-way. So we are going to discuss it, or we are going to do it in our practical application, in our actual. Okay, so there is a hand rubbing, which is simplified into three steps only. This is about how many of those? There are about 9. So we are not going into 9 because according to the studies, this 9, the 3 simplified one, it's more better. I mean, the simplified one is more better according to the study than to do it the whole thing. Okay, so they are I mean, they have a simplified hand rubbing practice. So number 2, in the standard precaution, we have the PPEs. We have the use of PPE. PPE are called the personal protective equipment. So it refers to the protective clothing, head covers, gloves, face shields, goggles, face mask, and or respirators, we called it N95, or other equipment designed to protect the wearer from injury or the spread of infection illness. So the number 1 purpose of the PPE is to protect us, to protect our clothing, or to protect us from the splash and the spill of the or the infection agent also. So protective equipment, personal protective equipment is the PPE. What are the 6 standard protective, personal protective equipment? So we have the gloves, we have gowns, we have face mask or the N95, the goggles or the face shields, the head cover, and the shoe cover. So there are 6 types. So in a healthcare facility, we are using these types of PPEs. In industrial areas, they have also the same. But in the healthcare, as we are going to work in a healthcare, this is our PPE, or the personal protective equipment. We have the mask, the hoods. Nowadays, They are using the disposable hoods when they are, taking care of those COVID patients, especially those those positive ones. So they are using the hood. Okay, so they are gloves, masks, shields. We have the N95, and we have the shoe cover. So these are we are calling it the PPE. So number three, in the safe precautions or the safe practices, the standard precaution, we have the safe injection practices. So what do we mean by safe injection practices? It is a practice intended to prevent transmission of infectious disease between one patient and another, or between a patient and a dental health care personnel during preparation and injection of medications. So while preparing, we do the practice while we prepare injection using a septic technique in a clean area. By the way, our nursing aides or the caregivers, mostly we are not allowed to do injections. But in preparing, just when you are seeing or looking into yung mga nurses natin when they are preparing, they are implementing the safe injection practices. They disinfect the rubber septum or the rubber cover of the vial. If you can observe them, they have, the vial, before they get the injection, there is a rubber vial. And in this, you have to wipe it with the alcohol before pricking. So do not use needles or syringes for more than one patient. This includes manufactured pre-filled. We have nowadays a pre-filled syringes. So we don't need already to just withdraw from another vial. So at least, especially for those insulin pens, so we are using it for our safe injection practices. Going for the safe handling of sharps and needles. So we have the sharps container where we put our injection, the used injections like disposable needles, all those sharps edges, blades, IV cannulas, all of those broken vials, we are putting it in the sharps container. We are not going to put it in a medical waste, okay? So we have to put it in a proper container, which is the sharps container. So what we do follow and what we do remember when we are practicing the sharp safety rules. Do not recap syringe needles or shear clip or bent needles. Once it is used, you just direct it in our sharps container. Do not recap. Do not put back the cover. Okay? Just throw it directly inside of the sharps container. Do not overfill sharps container. It must be 3/4 full. In this sharps container, there is a level. So once you see that it is already filled with the 3/4 full, you have to ask the housekeeping to collect it and dispose it properly to the waste storage room. Sharps container should be at the eye level and within your reach. Why? Because if you are going to put it below, so if you happen to have a pediatric patients or those patients, babies or younger patients moving around, they can touch it. So better for us as a standard requirement to be put in an eye level. Do not remove the sharps container top or remove the sharps from the container. Never, never that we have to remove the cover. There is a lid cover there that you need to cover it once it is filled. And never remove by your bare hands any sharps from the container. Like for example, it is like accidental that you have put the one that you are using which is not yet finished. So you don't remove it by your bare hands. Otherwise, you will be pricked because all of those without recapping. So that means to say all of those inside of that sharps container are open needles. And if you want to remove it, just use, we have the forceps. We have the metal forceps that's being used when you pick those inside of those, if in case only, but never do that. Do not put your hand into a sharps container that is already in use. And that is another never, do not do it, is do not put your hands inside of that. You will be pricked or you will be injured. So number 5 is respiratory hygiene or the cup etiquette. It is one of the standard precaution. So these are the terms used to describe the infection prevention measure to decrease the transmission of respiratory illness. Or like for instance, the influenza, cold viruses, and number 1, it's our COVID pandemic. Respiratory hygiene is a part of standard precaution that should be taken to prevent the spread or disease. So the respiratory, why we call respiratory, it is droplet infection. So we have to be careful while disposing the handkerchief or the hankies, towelettes that we use when we cough. So number 1 is the respiratory etiquette is to cover your mouth and your nose when coughing and sneezing. Or if you use a tissue, throw them in a proper way. Wash your hands or use a hand sanitizer every time you touch your mouth or nose. You don't, if you just cough up with your hands, using your hands, you don't touch anywhere of your face. Okay, so because instead of use the sanitizer to clean your hands before touching it. So number 6 is the patient care equipment. So when dealing with the patient care equipment, healthcare workers should do the following. Number 1, we have to handle equipment that might be contaminated with blood in a manner that prevents skin and mucous membranes exposures, contamination of clothing, and transfer of microorganisms to themselves and other patients and surfaces. What do we talk about the patient care equipment? It is all about the patient use, the patient medical equipment or devices, mobility aids, or anything that the patient has been using. Like for example, the beds, the wheelchair, the IV stands, the portable Mayo table or the injection trays. All of those are the patient care equipment. So evaluate equipment and devices for potential cross-contamination of blood. If you find any blood somewhere in this stain, in those patient care equipment that has been used by the patient, so automatically wipe it, take a glove, and wipe it with a Kabi wipe. We have a Kabi wipe, the antibacterial wipes that's been used nowadays. So they should also establish procedures for the safe handling of such equipment during and after use, including cleaning and disinfecting and sterilizing as indicated. So those, as I told you, those instruments, medical devices, has been used in an operating room, operating or during the surgery, they are going to be sterilized. Okay, it is not only disinfected, but they need to be sterilized. Cleaning and disinfecting the environment. So cleaning is necessary first step of any disinfection process. Usually, the first step is to clean. Just clean it up first before disinfecting it. And in cleaning, it removes organic matters, salts, visible soils, all of which interfere with microbial inactivation. The physical action of scrubbing with detergents and surfactants and rinsing with water removes substantial numbers of microorganisms. Remember, in cleaning, it removes or kills substantial number of microorganisms. It is not 100%, it is not most, but a substantial amount, a substantial number. So that when we do our cleaning by soap and water, only substantial number of microorganisms are being removed. So when we talk about disinfection, there are three kinds. As we said, we have number one is cleaning with soap and water. So when cleaning, it is substantial amount of microorganisms are being removed. While in disinfection, it destroys most pathogenic and other microorganisms by physical or chemical means. So cleaning is substantial amount or number of microorganisms. And in disinfection, the most pathogenic and other microorganisms are being killed. So in contrast, sterilization, it destroys all microorganism. So the best thing is for sterilization. But this only, that we are only doing the sterilization by heat with those operating room instruments or those dental care instruments. Not all. But when you are doing the sterilization, it destroys all microorganisms. 100% all microorganisms. It includes substantial from the cleaning and the resistant bacterial pores by heat. We are using here the steam autoclave or dry heat and unsaturated chemical vapor or liquid chemical sterilants. So now we know the difference between the three. The cleaning is when killing the substantial numbers of microorganisms. Disinfection is killing most pathogenic or other microorganisms. And when sterilizing or sterilization, we are destroying or killing all 100% of the microorganisms. So management of linen and laundry. So this is a part of the standard precaution or the standard measure that we need to implement or to practice. The best practices for linen and laundry handling. So we must know also how to manage or handle our laundry. So when we are following the best practices, okay. So the best practices for our linen and laundry handling, number one is always wear reusable rubber gloves before handling soiled linens. So when doing our bed making or re-sheeting or redoing our bed making, removing the sheets, we need to use our gloves, okay? So we have to protect ourselves before handling soiled linens. Never carry soiled linen against the body. So we never put those soiled linens near our body. So keep it away. Carefully roll up soiled linen to prevent contamination of the air, surfaces, and cleaning stuff. So what we do in here, when we manage our soiled linens, so just roll it and directly or immediately put them in a dirty laundry bag or dirty laundry hamper. We are calling it a dirty linen hamper. So transmission-based precaution. We are talking about the transmission-based precaution. What are we going to do or what we do based on these precautions, okay? So how to prevent those transmission of microorganisms or infective agents to the other people. Transmission-based precautions are the second tier or the second level of basic infection control and are to be used in addition to standard precaution. So this is another level of standard precaution that we are talking about. So especially we are using it for those patients who may be infected or colonized with certain infectious agents for which additional precautions are needed to prevent infection transmission. So what are we calling them? What do we call this transmission-based precaution? We have three precautions for transmission. Number one is the contact precaution. So we are using this contact precaution for patients with known or suspected infection that represent an increased risk of contact transmission. So the body fluids with the patients that we touch them during the time that we are taking care of them. So these body fluids, the blood, they are included as per our contact precaution. So what do we use? What do we do? We will come to know in the later share. Droplet precaution is the number two. Use droplet precautions for patients known or suspected to be infected with pathogens transmitted by respiratory droplets. Remember it, for the droplet precaution, the respiratory droplets that are generated by patient who is coughing, sneezing, or talking. So why we are doing this as our preventive measure in the COVID-19 pandemic? We are wearing masks, right? So this is because the respiratory droplets we are preventing. So in droplet precaution, we are wearing masks. So it is generated during the time the patients or other people are coughing, sneezing, or talking. So droplet precaution for respiratory or the coughing etiquette. Airborne is the last one for the transmission precaution, and it is used for patients known for suspected to be infected with pathogens transmitted by airborne route. Ano yung mga airborne route? What are those airborne virus or those airborne that it can be transmitted through air? So tuberculosis, measles, chickenpox, disseminated herpes zoster. So these are but few. So they are causing transmission of infection by the air, through the air. Okay, so we need to wear mask also here, or if it is possible, we are using our gowns. So these are the example signs or the posters. We use this when we are in a hospital setting, when the patients are in contact precaution. It's been ordered by the doctor to put a contact precaution sign outside of the door. So this contact precaution, it is there to put outside of the door. So all those people entering the patient's room, so they have to be properly, advised or guide with this contact precaution thing. So what do we need here? We have our hand sanitizing, or if there is a sink nearby, so wash the hands. And we have to use our gloves and our aprons or our disposable gowns to protect ourselves. Going to the droplet precaution, there is a poster that says to guide the people who are going in with those respiratory infected patients. So what do we need here is the same way, every now and then before wearing our PPE, especially for the gloves, we need to hand sanitize and or hand wash. And then we will be using our mask and our gloves, and if it is possible, our gowns also, or the disposable aprons. In airborne precautions, so we do the same. We will post a poster of airborne precaution just to guide those people who are coming to visit the patients that this patient needs an airborne precaution. So what do we need, to post in the door? So we need, before coming inside of the patient's room, so we need to hand hygiene or hand washing. So we will put our gloves, our mask, and our disposable gowns. Okay, so we go with the proper patient placement. We will ensure an appropriate patient placement when we are putting the patients together in a room. Or there is a patient placement coordinator. They use their diagnostic or triads or other information in conjunction with medical staff to outline a plan of care that determines where the patient will be assigned, matching this to this department or the nursing units, and estimating a discharge date. You know, when the patient is coming to the center or to the hospital, there is, in a big hospital, we have a patient placement coordinator, or we are calling them the bed coordinator. So when the patient is going to be admitted, so she is the person to be responsible or the first person to be contacted. I have a patient like fever, and I have a patient like with tuberculosis. So where are we going to put these patients? So patients are for admission. So these patients, this patient placement coordinator is the one going to inform you that this patient tuberculosis is going to be put in a separate room, in an isolation room, in an airborne precaution room. Okay, so if there are two patients going to be placed in like two bedded rooms or four bedded room, so the bed coordinator knows what are the condition or what are the diseases these patients have to be included in one room. So there must be a patient placement. Like all patients who are having diarrhea are going to place inside of this four-bedded room, not together with just operated patient putting inside of this tuberculosis. No, it is not, proper. So she knows exactly what is the condition of those patients to be placed appropriately in a certain placement. So talking about the waste management and disposal. So in a standard precaution, we include the waste management and disposal in preventing the transmission or the spread of infection. Waste is called or defined as anything which is not intended for further use. It is termed as waste. Anything that is not included, anything to be thrown away, doesn't function anymore. Those are called waste. And medical waste is a kind of waste that contains infectious medical material or material that is potentially infectious. So medical waste, we are calling them as potentially infectious waste. They have the tendency that can harm the people. So it is potentially infectious. So hospital waste is any waste which is generated in the diagnosis and treatment of human beings, the patients in the healthcare facility. So it's called in general the hospital waste. And waste management is the management of waste produced in the healthcare facility. So how do we manage it accordingly, appropriately, with the proper disposal of the waste? So we have two types of waste that is being produced in a hospital or a healthcare facility setting. We have number one, we have the hazardous waste. Okay, so we are calling them as the waste with properties that are potentially harmful to human health and to environment. They are called hazardous waste. And another thing, the number two is the non-hazardous waste. They are just waste that does not cause harm to human beings and to environment. So we know now that these two types of waste, the other one is there is a potential harm or harmful to human health and environment. Whereas the non-hazardous, they are considered as the domestic waste. They are not causing harm, or they does not cause harm for the human beings and the environment. So according to this, we must be careful with hazardous waste. So we are going to discuss the hazardous waste here. So we are having different kinds of hazardous waste. What are those hazardous waste that being generated in a hospital or in a healthcare facility? Number one is the medical waste. These infectious medical waste, they are contaminated with blood and other bodily fluids. Example are the discarded diagnostic samples, cultures, infectious agents stuck from the lab, waste from those patients being autopsied, yes, infected materials from the lab, or any waste from patients in isolation wards and equipments, the swabs, bandages, disposable medical devices, all of those that has been in contact with patients, or all of those that are being used by the healthcare providers when in contact with the patient are being put and categorized as infectious medical waste. We are putting it in a yellow bag. So any materials having been in contact with infected patients, cultures of microorganism in a nutrient medium from the lab, so waste from surgery or autopsies of the post-mortem bodies, they are all placed in an infectious waste bags. So number two, we have the pathological waste. Pathological waste means they originate from tissues or samples of tissues that are infected and or examined in the lab to diagnose or study. They are the human tissues, body parts, and organs. All of those body parts and organs which are being removed from the operating room, they are being put in a pathological waste. Fetuses, those unborn babies. So those stillbirth. So those babies being born, fetuses, if most of the parents, they are not taking it home, so they are being disposed in a pathological waste. Blood and body fluids that is being used inside of the operating room or the post-mortem room, they are being disposed in a pathological waste. Sharps. So we talk about sharps as objects having an edge or a point that is able to cut or pierce something. So we have the needles, the syringes, scalpels. They are the blades. They are called scalpels. Infusion sets, saws and knives, surgical blades, broken glass, any other items that can pierce the skin or cut and puncture, they are called sharps. So they are going to be placed or disposed in a sharps container. So pharmaceutical waste are defined as any chemical or biological product medicine that is intended for use in the diagnostic, cure, mitigation, care, treatment, or prevention of disease or injury of the human. So these are the ways like the expired or unused pharmaceutical products, those products that has been expired from the pharmacy. So they are called pharmaceutical waste. So spilled or contaminated pharmaceutical products, surplus drugs, those expired or those drugs that has, more of the stocks, vaccines or serums, discarded items used in handling pharmaceutical bottles, gloves, masks, and tubes. So they are being disposed in a pharmaceutical waste. Genotoxic waste. They are waste that may have mutagenic. Mutagenic means it can double. Teratogenic means those, fetuses that has been died with deformities. So they are, according to them, they are born from the mother who had used cytotoxic drugs during their pregnancy or another drugs during their pregnancy. So it produces a teratogenic waste or carcinogenic properties like the cytotoxic drugs and outdated materials. Those drugs that has been used for the patients who have cancer. vomiting, feces, or urine from patients treated with cytotoxic drugs, chemicals, and radioactive materials. Those patients using diapers with the radioactive materials after they have been treated with the radioimmunoassay or the radiotherapy for the cancer patients, all of those, the materials that they have used with patients' vomit, with the patient's fecal matters or urine, they are being put and considered as the genotoxic waste. Chemical waste are disinfectants. They are solvents, reagents used for laboratory purposes, the batteries, heavy metals from medical equipment such as mercury or the broken thermometers. They are examples of the chemicals from diagnostic and experiment works, cleaning processes, housekeeping and disinfecting procedures, mercury waste, such as the broken clinical equipment spillage. That's why nowadays, you will not find any of these medical equipment that has a mercury. They banned it already. They pulled out in the market because of this clinical equipment spillage. It can cause cancer, or it can cause irritations to the skin. So all of this now has been banned, so you will not see them anymore. So instead, they put a digital blood pressure machine or a blood pressure device or a thermometer now. It's all digitalized. They have removed it from the market. So cadmium waste mainly from discarded batteries. So all of this are the chemicals that is being going to put into a chemical waste. Radioactive waste. This waste includes liquid, solid, or gaseous waste contaminated with radionuclides generated from in vitro outside analysis of the body tissue and fluid, or in vivo body organ imaging and tumor localizations and investigations and therapeutic procedures. It can also consist of any glassware or other containers contaminated with radioactive liquids. So radioactive waste, they are coming from the analysis of the body tissues, which they use radioactive materials. So they are very infectious. So they are being put in a radioactive waste bags with a logo or with a symbol that has a radioactive hazard. Okay, so we will know from the outside that this one is a radioactive waste. So when we talk about the non-hazardous waste, they are the general waste. It is generated from the office supplies, from the paper wrappers, from the kitchen waste, general sweeping waste, and they don't impose risk to human health and the environment. So they are non-hazardous waste. Talking about the notification of communicable disease as one of the standard precaution, it is a set of protocol. So these are the set of protocols that we need to remember when we have the standard precaution in preventing the spread of infectious disease.